Good afternoon everybody. Today we have a class on vitamins and minerals. So you all may be knowing that we need to take vitamins and minerals for the normal functioning of our body. Do they provide us some energy, vitamins and minerals? Carbohydrates, proteins, lipids, they provide us energy. What does this vitamins and minerals provide us? They help in various metabolic reactions. Okay, today we'll be learning that. Okay, vitamins are the organic compounds needed for the normal function, growth and maintenance. And they are not the energy providers, they are the cofactors for various metabolic reactions in the body. So we have two types of vitamins, okay, fat soluble vitamins and water soluble vitamins. So fat soluble vitamins we have A, D, E and K. Okay, so A, D, E and K, you already know these vitamins, still we will be brush up for your knowledge. Okay, so A, it is a vitamin A which helps mainly in our vision. Okay, so these are also used as antioxidants. They are helpful in maintaining the epithelium, membrane integrity. All these things are maintained with the help of our vitamin A. Okay, these are orange, and the vitamin A bearing sources are called as carotenoids. Okay, and we have vitamin D. How do you get our vitamin D? With the help of sunlight, we can prepare our skin can prepare the vitamin D. Milk is also a rich source. Okay, this vitamin D helps in maintenance of the calcium, potassium, phosphorus ratio. Vitamin E, it is also called as tocopherol. Okay, it is again one more antioxidant which is given for the aged people. It is given for the menstrual regulation, and most of the cases where the patient is having severe diseases, chronic diseases, we supplement them with vitamin D. They help in prevention of stroke, heart disease, cancers. In all these agents, in all these conditions, they act as a antioxidants. And aging is considered as an oxidative procedure, and here are the agents which reverses the aging, that is antioxidants. Vitamin K, do we remember warfarin, a drug which was used as an anticoagulant. So vitamin K dependent clotting factors were blocked by our warfarin. So vitamin K regularly what it does, it helps in gamma carboxylation of our clotting factors. So coming to first vitamin of this fat soluble vitamins, it is vitamin A is also called as okay. So vitamin, it is used in food industry as a colorant. It gives the orange color. It is a antioxidant, and it is stored in the liver. As it is fat soluble, it can be stored in the body. That means the vitamin A cannot be given in excess dosages. In excess dosages, if it is given, it can also cause some problems. Okay, so something called as there are pseudotumors. All these are there. Commonly, we are accompanying what the babies are getting problem is vitamin A deficiency, and it is one of the preventable cause of blindness. Okay, so first, when the vitamin deficiency is there will be eye in the sclera. We can see the discoloration, what we call it as xerophthalmia, dry eyes, dry skin. All these symptoms will be there, and it can progress to night blindness, where the patient will not be able to see in the night times. Then finally it can go for complete blindness. Now the researchers are trying to use this rice which contains vitamin A. Okay, these are genetically engineered rice, that is also now tried to prevent this night blindness. The next important vitamin is vitamin D. Okay, it is also known as calciferol due to its role in calcium absorption. Vitamin D, it forms hydroxylated in the form of cholecalciferol. Okay, 127 dehydrocholecalciferol, what is there, which reacts in various metabolic reactions. The main role is to maintain the calcium. It increases the calcium absorption, prevents the bone resorption, and maintains the optimum calcium levels in the plasma, and potassium levels are also maintained. And it is the only fat soluble vitamin which is produced within the body in the presence of sunlight. Okay, and it can also be made from the cholesterol. Here you can see what is this condition. Vitamin D deficiency can lead to bowing of this limbs. What is this? Is rickets. Okay, and in adults it can cause osteomalacia. So vitamin D deficiency can occur when you are not exposing ourselves to the sunlight. Okay, so there will not be chain of reactions which can synthesize our vitamin D. So it is stored in the fat tissues. Vitamin D deficiency can be seen in elderly patients. Elderly persons are more at risk. Okay, and its main target is on intestinal mucosa, kidney and renal tubular tissues. So if vitamin D excess is also there, we can get kidney stones, okay, and renal problems can also be there. Primarily they are helping us in calcification of the new bones. You saw it in the previous slide. There is rickets, maybe how it looks. Okay, in adults, if it is deficient, it can lead to osteomalacia and poor bone formation. And toxicity, if the calcium deposition is excess, it can form renal stones. And in the heart, blood vessels also, in aorta, sometimes calcification of the valves can occur and can lead to stenosis of the valves. Vitamin E, it is tocopherol. It is an antioxidant present in the food. Vitamin D 400 mg supplementation is also given for aged patients and menopausal patients. We can give this drug. Since aging is considered as an oxidative reaction, and many antioxidants and preparation of this vitamin E are used as a supplementation. And the deficiency of vitamin E leading to disease is rare, but vitamin D supplementation can help in recovery of the patient from stroke, cancer and immune response diseases, chronic granulomatous diseases. Coming to vitamin K, it contributes in the synthesis and gamma carboxylation of the clotting factors 2, 7, 9 and 10. And once the action is not needed, we can go back to reactivation and continuation of the biological clotting thing. This warfarin or the anticoagulants, they are used after stroke or anginal effect where the platelet plug has blocked our blood vessels. Here vitamin K, it can act as a cofactor for the enzyme and makes to bone protein. Coming to the next group, water soluble vitamins. B1, thiamine, B2, riboflavin, pyridoxine, B12, cyanocobalamin, biotin, pantothenic acid, B5, okay, niacin, folic acid, B9, all these things are there. Vitamins C or ascorbic acid, all these are water soluble vitamins. So as we know, this is water soluble and those ADEK were fat soluble. Fat soluble vitamins, they can get stored in the body, but water soluble vitamins, their supplementation should be there in day-to-day life. Okay, so as these are not stored in the body, they should be present in our food daily. Vitamin B1, thiamine, it is involved in carbohydrate metabolism and they help in metabolization of the glucose, and they are helpful in the maintaining of the central nervous system. Deficiency of this can cause peri-peri, and again there are two types, wet peri-peri, dry peri-peri, where the heart is also involved in this disease. B2 riboflavin, again it is involved in energy metabolism, carbohydrate metabolism reactions. Coming to niacin, B3, okay, here this is again, this vitamin is again involved in energy metabolic reactions. If the person is not taking enough of this B3 niacin, what can happen? First, the person will have dermatitis reactions, okay, skin reactions can be seen. Later, the patient will have diarrhea, okay, continuous diarrhea will be there because of lack of this vitamins. Then person will have mental symptoms, dementia, that means forgetfulness, and if you still do not interfere and supplement with niacin, the person can die because of this symptoms. So here you can see the skin lesions, okay, and coming to the next, that is B5 pantothenic acid, B6 pyridoxine and biotin. So pantothenic acid, it is found in many foods and helpful in metabolism of the carbohydrates, proteins, alcohol and fat. And pyridoxine, it is helpful in formation of the neurotransmitter. It is coenzyme for more than 100 reactions. Pyridoxine is helpful in so many reactions. Biotin, B7, it is involved in fatty acid synthesis, and deficiency of which can cause skin disease and hair loss. Have you consumed eggs? Yes? Raw eggs? Anyone has consumed raw egg? Cooked one? Boiled one? Everyone has eaten? How many of you have consumed raw egg? Okay. So what will happen if you consume raw egg without cooking? It can block. There is some protein called as avidin which is present in the raw egg. And once this you have consumed this raw egg, what can happen? This can go and block the absorption of this biotin. Okay, that's why what will happen? There will be deficiency of biotin in the people who consume raw egg. So it is always good to take a cooked boiled egg where this avidin will be denatured and biotin absorption will not be blocked. So that's why biotin deficiency can go for skin diseases and hair loss in those persons who can consume this raw eggs. Naturally, there can also be deficiency of this biotin because of nutritional deficiencies. Coming to folic acid, it is chemically pteroyl glutamic acid. It is B9 vitamin. Okay, folic acid, it occurs as a yellow crystals. Folic acid and B12, these are the primary maturation factors for the RBCs. Okay, so because of this presence of this folic acid and B12, the RBC size will decrease and they can mature themselves into erythrocytes. RBCs, if these vitamins are not present, B12 and folic acid, what will happen? They will never mature, and the immature RBCs are bigger in nature. Okay, that's why we get a type of anemia called as megaloblastic anemia. Have you heard of this megaloblastic anemia? So this is a type of anemia where big RBCs are seen in the peripheral smear. Okay, this is because of immature RBCs. Where it is observing, it is observed from the jejunum part. So dietary sources are liver, green leafy vegetables, egg, meat, milk, soybean, all these are there. Mechanism of action, it gets converted to folic acid, dihydrofolic acid, tetrahydro, and helps in 1 carbon transfer reactions. Do you remember the drug which blocks this conversion, dihydro to tetrahydrofolic acid? We have learned that. Okay, so yes. So mechanism of action, here you got to know it is 1 carbon transfer reaction. Functions are, it helps in synthesis of purines, pyrimidines. Where these purines, pyrimidines are there? Building blocks of RNA and DNA. So they are helpful in all these reactions. Nucleic acid synthesis, large erythrocytes are seen in deficiencies, and requirement here is 1 to 4 milligram per kg body weight. Folic acid, it is used in megaloblastic anemia in methotrexate toxicity. What happens when methotrexate is given? If in large quantity, it can also inhibit the normal functioning of the body. Normal body synthesis of cells is also inhibited. That's why we call it as citroverum rescue factor, which is used in methotrexate toxicity. It is also a part of this anti-epileptic therapy. Coming to the next, deficiency can go for anemia, megaloblastic anemia, epithelial damage, weight loss, sterility, all this can be there. Adverse effects, they are usually non-toxic, but injection site reactions can be there. Coming to B12, again B12 folic acid, they are acting together, okay, and again once B12 is deficient, the maturation of the RBCs is prevented. Maturation factors, okay, these are called basically as maturation factors, and deficiency of which can lead to megaloblastic anemia. And the commercially available preparations are in the form of cyanocobalamin and hydroxycobalamin, which are complex cobalt containing compounds, and they are supplemented. The other dietary sources are liver, kidney, sea fish, egg yolk, meat. Most of it is non-vegetarian. That's why the vegetarian people, they can get this B12 deficiency. And these stores of vitamin B12, even though it is a water-soluble vitamin, the stores of which can last for more than a year. In the liver, they can get stored for at least the stores will be for minimum of 1 year. And the persons who are deficient of this vitamin B12, they get this pernicious anemia, okay, where intrinsic factor for the absorption will be less. We'll be seeing it in the diagram. So vitamin B12 is intricately linked with our folate mechanism. They go hand in hand, and if there is deficiency, they can go for megaloblastic anemia, okay, and we cannot distinguish whether it is a folic acid deficiency or vitamin B12 deficiency, because both are going hand in hand in maturation of these RBCs. This B12 is again essential for cell growth, multiplication, and myelination layer is also for formation of this myelination, it is helpful. So if vitamin B12 is deficient, there is degeneration of the spinal cord and age-related back pain, okay, and sometimes we get this chronic pains in the legs, sciatica. In all these conditions, we give this injection methylcobalamin. So here you can see in brief the B12 absorption. There is something called as intrinsic factor, okay, intrinsic factor which helps in absorption of this vitamin B12 in the body. With the help of this intrinsic factor, it can enter the intestine. Okay, first your consumption, first step, then the conversion into active form, then with the help of this intrinsic factor, it gets combined, and here is our vitamin B12, which can go into the intestinal lumen with the help of this intrinsic factor, and intrinsic factor is released back, and this cobalamin enters into the body. Okay, can you see here? So 20% is going for stores, 80% is circulated. So what can happen after vitamin B12 deficiency? Vitamin B12, we know it is leading to megaloblastic anemia, and others are additionally in pernicious anemia. This pernicious anemia, when intrinsic factor is not available, sometimes congenitally the patients will not be having this intrinsic factor in the stomach. So once intrinsic factor is not there, there is no proper carrier for this vitamin B12 for its proper absorption, and without proper absorption, it can lead to this problem. and if the person is not having this intrinsic factor, the treatment of this vitamin B12 supplementation will be lifelong. So what are the other, there can be other causes of mucosal damage that can be prevented here: chronic gastritis, all these conditions where the intrinsic factor deficiency can occur. Nutritional deficiency, less common among non-vegetarians but common among vegetarians. Then in pregnancy we need to supplement this because there is lot of growth taking place and additional dosage is needed. Uses: B12 deficiency, megaloblastic anemia, neuropathic conditions, psychiatric disorders, fatigue. All these persons we give this cyanocobalamin, hydroxycobalamin injections. Coming to the vitamin C, ascorbic acid, it is mainly present in the citrus fruits. Okay, nimbu, lemon, orange, all these things contain this vitamin C, and people used to consume these citrus fruits but never thought that this deficiency can lead to some diseases. This deficiency or disease was once noticed when the people traveled in seas, high seas. They traveled in the ships for months together, and this seafood, okay, maybe fish, whatever you consume in the sea, these foods are deficient in vitamin C, and these vitamins are present only in the citrus fruits. And people after through 2 months, 3 months after ship travel, they used to get this diseases. You can see. Okay. First, what happened? The person used to fall ill. There could be skin reactions. There was bleeding tendencies. All these things were there. Okay, jaw pains. All these things were there. So, what the people used to do? They didn't know that what is happening to them, and finally, when it was diagnosed, we got to know that it may be due to the vitamin C malabsorption. They used to eat their own friends' hands, legs. They become cannibals just because to get some source of vitamin C, and they get cured of this disease. So that tendency was seen among the inmates of this high seas travelers. So deficiency can lead to bleeding gums, hemorrhagic tendencies. All these things were seen. So coming to the next, minerals. Okay, these were the vitamins which we discussed. Okay, now we have the another minor components of the body that are minerals. So calcium, phosphorus, potassium, sulfur, sodium, chloride, magnesium, and iron. All these are, though they are the minor components, but still they play a very important role. Coming to the first thing, iron. Iron is important? Yes? Can you remember some iron containing foods? Mainly non-vegetarian foods are there. Along with that, fruits, jaggery, dry fruits. So many sources are there. Okay. So total body iron, how much it will be in adult? It will be just 2.5 to 5 grams. More in men. Hemoglobin among this, where it is primarily distributed, 66%. Majority is in form of hemoglobin, and other 25% in the form of stores. Some amount is present in the muscles and parenchyma. So hemoglobin, it is a protoporphyrin. It contains 4 iron containing heme residues. So daily requirement is about 0.5 to 1 milligram. If you see, you can see here the requirement increases in pregnancy. 3 to 5 milligram per day it is required. And another thing is only 1/10 of it is absorbed. Okay, 1/10 of it is absorbed means you need to give 10 times of it. Iron absorption, it is only in the upper part of the duodenum. and if at all some gastric surgeries has happened and this part is removed due to peptic ulcers, then there can be problem with iron absorption. It can also get disturbed in chronic gastritis, chronic alcohol consumption, all these conditions. The important thing we need to remember is food impedes the absorption. Okay, the drugs which can decrease the absorption are alkalis, phosphates, tetracycline and food. Acidic environment, non-veg, meat, if they are consumed, the ascorbic acid, that is vitamin C and some amino acids, they can increase the absorption of this absorption of iron. Ferritin content, it is iron which is absorbed and stored at the basal side of this cells, and when the iron is not required, they are shed off. As these are stored at the basal layer of this cells, we call it as a ferritin content mechanism. So iron, it is transmitted in the blood in combination with a glycoprotein transferrin. We need to remember transferrin, apoferritin. This will be explained to you in iron deficiency anemias. It is just in brief. Okay, so iron is stored in the reticuloendothelial cells, in the liver, spleen, bone marrow, and in hepatocytes. In myocytes as ferritin and hemosiderin. So iron, we have storage form ferritin and hemosiderin, and also transport form, that is transferrin and apotransferrin. So in menstruating women, there can be loss of about 0.5 to 1 milligram per day. So females need more of this iron supplementation. Where we can use this iron preparations are there in the form of ferrous sulfate, ferrous fumarate, ferrous ascorbate. These are the oral formulations. We have intravenous formulations such as iron dextran, iron sucrose, all these things are there. Okay, iron sorbitol, citric acid complex. Intravenous preparations or intramuscular injections are given when the patient is not having good oral compliance. This iron tablets, they are tendency to cause gastritis. Okay, so gastric irritation the person may not be able to take, and if there is severe deficiency, what can happen? The oral stores, or I told that only 10% of it can be absorbed. So that means very less percentage is absorbed. So if the iron, for example, hemoglobin is less than 10 milligrams, okay, per deciliter, we can go for intravenous intramuscular injections. But it is more like 11, 12, we can go for oral formulation. What is the normal hemoglobin percentage? It should be there 13 to 15. Okay, you know that. So it is more than 10, we can go for oral preparations like ferrous ascorbate, ferrous sulfate, all these things are there. So iron deficiency anemia, commonest cause anemia where we can use it. Repeated effect of malaria where there can be blood loss, chronic inflammatory disease. In all these conditions which can lead to iron deficiency anemia, we can go for it. Megaloblastic anemia, though there is B12 and folic acid deficiency, once we give this folic acid and B12, what can happen? There can be rapid blood cell formation. This rapid blood cell formation, there can be acute shortage of iron. So there also we need to supplement this iron. So iron status of this patient should be evaluated and iron should be supplemented. Ferric chloride, sometimes they are used as a throat pain for throat infections. Coming to the next one, that is calcium. So 99% of this calcium is in the form of structural. That means in the form of bones. Okay, so it gives structure and shape to the body. Calcium is the primary ingredient of our bones, which are helpful in bone formation. So for calcium absorption, we need this vitamin D. Okay, so 75% of it is obtained from dietary sources. Can you tell me calcium sources? Milk, egg, rice can provide, ragi can provide, non-vegetarian food, meat. Okay, all these are primary sources of our calcium. So baby needs milk. Okay, that's why it is a rich source of calcium. And this vitamin, this calcium, it is formed in the youth, but as the maturity goes on, about 50 years, 60 years, it is patient will go for osteoporosis, osteomalacia is seen, where the bone resorption takes place. That's why it is lost in maturity. So daily requirement is about 600 to 800 milligram per day. Coming to the other minor minerals, phosphorus, it helps in important reactions in the body, okay, metabolic reactions. It is absorption is enhanced by vitamin D, and deficiency diseases due to phosphorus deficiency are very rare. This potassium deficiency can occur, primary electrolyte in the blood associated with low blood pressure, okay, and in athletes we need to supplement this. You know, this vital electrolytes, potassium, sodium, their levels are checked in cases of malabsorption syndromes and the patient is having severe diarrhea. We need to maintain the serum potassium levels something like between 3 to 6. And in case of renal failure, what can happen? There can be increased potassium levels and increased sodium levels. In those conditions, we need to decrease the levels with the help of this hemodialysis and all. So potassium forms an important component there. Okay, in case of this the drugs which act on decreasing the blood sugar levels, they are also acting on this potassium channels. So decreasing the potassium or increasing the potassium levels, both are dangerous for the body. Sodium chloride, do you remember sodium chloride? Where do we use it? Normally daily. Do we eat this? Yes? Salt. So without salt, can we eat food? No. So, but if you put it excess, what can happen? It can lead to hypertension. Okay, so